All right, Dr. Paul Fadale, University Orthopedics. All right, you hear the news. Rob Gronkowski, herniated disc, surgery tomorrow. How serious of an injury is this? They say the timetable is 8 weeks. In your expertise, what does this mean?
Unfortunately, he has a history of back injuries. Going back to 2009, he missed a ton of time. 2013, missed a little time. Third go-around with back surgery, back injury. So they say 8 weeks, but I'm not really sure how accurate that is. If it's a small and not consequential herniated disc, maybe a little sooner, probably not. This could be something that could affect his career a little bit. So we're going to have to wait and see how big the injury was, how much surgery does he really need, and how much recuperation that back requires after the third go-around.
You mentioned the two previous surgeries. How much of an impact do those have on his A, recovery, and B, just his long-term health moving forward?
Well, it's unfortunate. I think everyone who's listening to us tonight has back pain. And unfortunately, a lot of times with the surgeries, they don't always get it all because there's different segments in the back, and you may fix one, and now the next segment goes. And so sometimes it goes right up or down the back, or a new piece of tissue gets pushed out. So it does have an effect. All these cumulative surgeries makes it harder and harder and harder to maintain a healthy back. And he's in incredible shape, but it still doesn't make a difference. He's at risk.
He's bounced back from 2 back surgeries. This would be a third. In your estimation, will he ever be the same player? 75%, 80%? What level will he get back to?
Well, I think he can come back 100%. The game is, when does he come back? So now the Patriots are pushing for a Super Bowl, and right about the time he may be clear, now do you put him back in as he's deconditioned and not ready to go and put him at risk for another injury? Or do you say, we're done, shut him down, rehab him all summer long, come back next year fresh, play another 5 years or more? That's a tough decision by him, his family, and the medical staff.
You've been part of those decisions with teams.
Yes.
Whose call is it ultimately in the push-pull of, you're not, doctor says, hey, I could clear you, but you're not, you're at risk, and at that point it's in the player and the team's hands?
The medical staff, their job is to give the facts and not give emotion. So you say, here are the facts, here are the risk factors. What do you want to take? The team says, right, we'd like this, we don't like that. The athlete really has to take the risk because there is no guarantee in any surgery or any outcome what's going to happen. We do know the longer you wait, the better your chance to recondition, get out of the surgery, and be healthy for the long term. But with the allure of a Super Bowl, he's a tough kid. Who knows if he'll try to come back.
So the surgery on Friday, we talk about this 8-week recovery. What is going on week 1, week 2, going forward into early February, late January? Take us through the recovery for where he would potentially be back.
So with any surgery, you're going to be weak. And at that level, you start deconditioning almost immediately. And so he's not going to be doing very much at all. He wants that back to rest. He wants the incision, the tiny little incisions, to heal. You don't want infections or other problems. So they're going to shut him down for a while. And then his physical therapist, there's probably a team of them, are going to slowly bring him back to get him back in some sort of shape and condition. If you push too hard, the back flares up. It starts to hurt. We have a setback. And so that's a thin line they're trying to walk to get him back. That's why that 8-week timeline may be just a vague concept for now.
So long-term, him coming back too early, what kind of impact would that have on him? Is there a scenario in which he comes back and this, affects him in his everyday life, or where he can't play football again?
I think the chances of that are very small, but they're not zero. Those are very real. And at that level, even a little back pain after a while starts to affect your capacity to play. So we don't know this, but now he's getting injections every other week to quiet that back down. It has this cumulative effect. Once you start this process, sometimes it just lingers and it never goes away. So that's the discouraging part of number 3.
I want to ask you about the play in itself. We were just watching in the sports office. It wasn't a play in which he went down and seemingly hurt the back. I mean, obviously he did hurt it, but it didn't look bad. So is that just the nature of a back injury where it can be something seemingly inconsequential?
So we all watched the ACL go and we shuddered.
Right.
We all watched him get hit in the chest, my God, like a freight train. We saw this athlete land on his back. This has been done a million times before, and everyone said, what happened? What happened? Well, the difficulty is he's got a little weakness in his back. Now, 2 surgeries later, it's always going to be fragile. And what we will never know is, as the season wore on, he was kept out for part of the season for maybe a hamstring, maybe not, maybe sciatica. We don't really know what the team was covering up. So it didn't take a whole lot to set this thing off, and it's a little concerning that just a short while later he's in an operating room. So that makes us think that this didn't just start when that guy landed on his back. This has probably been gurgling all season.
Quickly, I want to ask you a Tom Brady question. He's dealing with the knee right now, missed some practice last week, was at practice today, but how does that affect him as a quarterback there? Not the most mobile guy, although we've seen him run a little bit more this year. How does that knee affect Tom Brady as a ball thrower?
So we don't know 100% what it is, but in general, I think it would affect him less than almost any quarterback in the NFL. He is not mobile, and he has such a command of the game that he doesn't waste a lot of energy out there. He doesn't get hit a whole lot.
Right.
So if any quarterback in the NFL can take that, I think he can. He's always prepared for these games, so he doesn't have to go through thousands of reps in between. They have the luxury of resting him and having him come fresh for every game. So I think the risk is a little low, but because it's Tom Brady, people are concerned.
All right, Dr. Paul Fadale, thanks so much for your insight, and we'll talk to you the next time there's a serious injury.
Thanks.